Being from Chicago, I keep my jacket on because we're not wimps out there. Nothing bothers us. I'm here today because years ago I was practicing medicine in an office on the south side of Chicago with my partner and great friend, Dr. Quentin Young. You betcha. When a young community organizer came to see me as a patient, I became his personal physician for 22 years, and he became President of the United States. I support and admire him, consider him to be the most promising president of my lifetime, which stretches back to 1938. But I respectfully differ with him on his approach to healthcare reform. I speak to you today as an advocate for the single-payer approach to health reform and expanded and improved Medicare for all. But I'm hoping that President Obama and Congress will hear me also. As some of you may know, I was supposed to be at the recent town hall meeting at the White House where I was to ask a question of the President. But my visit was canceled at the last minute, presumably to prevent the national airing of my views on health reform. Is the single-payer message so dangerous that it cannot even be discussed by Congress and the administration? Yes, there are parties who stand to lose out under a single-payer program. The for-profit health insurance companies and their multi-millionaire CEOs in the first place. The head of Aetna, for example, received $18.6 million in compensation last year. That's obscene. By the way, the dean of the University of Pennsylvania Medical School received $3.5 million. That's not much better. Investor-owned for-profit hospitals won't benefit from single-payer either. Neither will the big pharmaceutical companies who will no longer be able to sell their drugs at such outrageous prices. A single-payer system will be able to buy drugs in bulk and negotiate prices. Some critics attack single-payer, arguing that under such a program, government bureaucrats will be between the patient and the physician. In the 40 years I have been practicing under Medicare, I have never encountered an instance where Medicare has prevented proper medical care. On the other hand, insurance companies frequently interfere and block appropriate care. There are multiple problems with the present Congressional health reform proposals, but allowing private insurance to continue being involved is the most egregious. The insurance companies actually like many of the proposed reforms, including the requirement that every American purchase insurance or suffer a tax penalty, which would be a windfall to the insurance industry. That alone should be a warning. If they like it, I don't. I mentioned who will lose out under a single-payer program, but who benefits? The American people. Do they matter? Do we really care about the 50 million without health insurance as long as the rest of us have our own coverage? Do we think about the additional tens of millions who are underinsured, who face economic hardship or bankruptcy when serious illness strikes? Single-payer will offer secure, comprehensive, and quality care to all. A single-payer program could be implemented easily without disruption, as was the case with the traditional Medicare. This is a moral obligation. We are all responsible for seeing that health care is a right. That's the view of Physicians for a National Health Program. Opponents of a single payer say if the government pays for health care, the system will deteriorate. But we have two single payer programs already operating that work superbly, Medicare and the Veteran Administration Program. Medicare overhead is 3%, private insurance is 5 times that. Our nation is at a crossroads. We must not squander the opportunity of this momentous time. We must not give in to the insurance and drug companies. Instead, do what is right for all Americans. Please, Mr. President, Congress, enact and expand it and improve Medicare for all.